Hi, Mr. Bosley.
Yes.
Hi, my name's Tia. I'm going to be your student of physical therapy today. How are you doing this morning?
I'm doing good. You can call me Ryan.
Okay, Ryan. So I'm glad you came in today. It seems like you have some pain in your shoulder area. That's what your doctor had referred you for. Um, so what we're going to do today is we're going to get an idea of what's going on. I want to get to know a little bit about you and your symptoms. That's going to take about 20 to 25 minutes here. And then what we're going to do is move on to your actual physical exam that I'll be taking you through some tests and some motions to see how everything's moving to try and get a better idea of what's going on. And then we might follow it up with some exercises, and I might give you some home exercises to take home. And that'll take about no more than hopefully an hour, maybe 45 minutes. Does that sound okay with you?
Yeah, I guess that's fine.
Okay. All right, so let's start off with just confirming. It says that you're 25. When was your birthday?
July 2nd, 95.
Okay. All right. And then what do you do for a living?
I work for the post office.
Post office, okay. And what does working for the post office require you to do?
So I walk a lot.
Okay.
And I also drive a lot, so it's kind of like a mix, half and half walking, half and half driving.
Okay.
I will drive to like a neighborhood and I'll park and then I'll walk that neighborhood and deliver the mail and then walk back to the truck, drive the truck to the next neighborhood, walk that neighborhood, deliver the mail, go back to the truck. So.
Okay. So a lot of walking and driving. And how often do you work?
I probably work about 6 days a week.
6 days? Okay.
Yeah. Post doesn't come on Sundays.
Sunday. Yep. Okay, and then when you're doing the driving part, how long are those drives usually?
Normally the drives aren't that long, like neighborhood to neighborhood, depending on what route I get. So it could be like a 5-minute drive or it could be like a 30-minute drive, depending.
Okay. All right. And are you involved in any sort of exercise programs, hobbies, maybe some community activities?
Oh yeah, I do CrossFit.
CrossFit?
Yeah.
Okay. How often are you doing CrossFit?
Probably about 3 days a week.
3 days. Okay. And what does that require you to do, the CrossFit?
It's different kind of things. You know, you got lower body, upper body, lifting, squatting, jumping, you know.
Wow. Okay.
It's really like a full body workout, and that's what I like about it.
Okay. That's great. Glad you're staying active. So, for what you're coming in today, is that the pain that you're coming in for, is that causing you to miss any sort of workout sessions, or is it causing you to not work as much?
Well, I really don't like to miss working out, so I kind of push through it, but it has gotten a lot more difficult.
Okay. All right, well, I'm glad you came in today. I hope that we can address your symptoms so that you can get back to working out and driving comfortably without the pain. So what I want to kind of move on to is if you can show me where the pain is at, where it's located.
It's kind of back here, you know, kind of along my shoulder blade, so it really kind of interferes with me when I'm lifting.
Okay. How far up does it go?
Probably like right around here.
Right in there. And then how far down does it kind of
go? Probably like here.
Right in there. Okay.
Yeah.
And then does it travel anywhere down the arm here?
No, it's really just there.
Okay. All right. Anything on the left side there?
No, left side's fine.
How about in the neck area or the lower head?
No pain in the neck.
Okay. Anything up in the front?
No.
Okay. And how about in the tummy?
No.
And then anything below that or the lower back?
No.
Okay. And how about down the arm here? Any pain here?
No pain.
No pain? Okay. Okay, so just talking about that area there, if you can describe the pain for me in your own words.
Constant.
Okay, constant.
Yeah.
Okay. Any other way you would describe your pain?
It's kind of dull.
Dull. Okay.
Achy.
Okay. All right. And then on a scale of 0 to 10, 0 being no pain at all, 10 being the most pain you've ever felt in your life, how would you describe it at its worst?
At its worst, it's probably a 6.
6. Okay, so 6 out of 10 at its worst. Okay, and then at its best?
Probably a 1.
1 out of 10. Okay, and how about right now, just talking to me?
Probably a 3.
3 out of 10. Okay. All right. And are you having any numbness or tingling down either arm or anywhere?
Now that you mention it, my finger here has been been kind of numb.
Numb. Okay.
Mhm.
Numb and tingling. Okay. So just the numbness. Is there tingling as well?
Yeah, I guess depending on what I'm doing.
Okay. So numbness and tingling. Nowhere further up the body.
No, just my finger. Maybe sometimes into my palm.
The palm. Okay. All right. And if you could describe that, how often that's happening?
I guess I would say it comes and goes.
Okay. So it's not there all the time. It just kind of comes and goes.
Mm-hmm.
All right. So I kind of drew where I thought that your pain is having. Can you just go ahead and confirm where that's at? So here for the back, and then here for the tingling.
Yeah,
Okay.
that sounds about right.
Okay. So just a couple of questions. Have you had any, other than the numbness that you're having in the hand, do you have any numbness anywhere else?
No.
Okay. How about nausea? Any nausea lately?
No.
No. Have you been dizzy at all?
No.
Okay. Has there been a time where you've been walking and just kind of fell down for no apparent reason?
No.
Okay. And then any trouble getting out your words?
No.
Or just speaking? No?
Mm-mm.
How about swallowing? Any trouble swallowing?
No.
Okay. And then with your vision, have you had any trouble seeing, double or anything like that?
No.
No? Okay. All right. So let's kind of compare the two areas that we've talked about. Do you believe that the numbness and tingling that you're having in your finger here is related to the pain in your kind of back of your shoulder area?
Now that you mention it, whenever this pain gets really bad, like I'll start to feel the tingling, but I didn't really notice that before.
Okay. So when you have a lot of pain up there in the back of the shoulder, you start to get the numbness and tingling?
Yeah.
Okay. All right. So I have an idea of where it's at, how it's feeling, those different symptoms that you have going on. Can you at all kind of recall things that you do that really bring on those symptoms?
When I'm lifting at CrossFit,
Mm-hmm.
that's when it'll get pretty bad. The other day, there was something in the air, and I had a really big sneeze because of allergies,
Mm-hmm.
and oh my gosh, that hurt, like almost as bad as when I'm lifting. But I just kind of tend to push through.
Okay.
Can't let it get in the way of my workouts.
Yeah. So the lifting and sneezing bring on that pain?
Mm-hmm.
Okay. And if you could rate it on that scale of 0 to 10 that we talked about earlier?
Probably a 6.
6 out of 10? Okay. All right. So the lifting and the sneezing, are there any other things that bring on those symptoms?
I guess when I'm tying my shoe and I have to look down, looking down kind of hurts.
Looking down? Okay. All right. So looking down, lifting, sneezing. When you're looking down on the same scale, how would you rate that?
Probably 4.
4 out of 10. Any other things that bring on the pain?
On the drive over here, when I was checking my blind spot, it hurt a little bit.
Okay. So when you kind of look to the right.
Mm-hmm.
Okay. And on a scale of 0 to 10 for me, can you rate that pain?
I guess the 4.
4 out of 10. Okay. Okay. So just to clarify, so when you're looking to the right, it brings on the pain. When you're looking down, it also brings on the pain. And then when you're doing those lifts and when you're sneezing, you also get those symptoms.
Yes.
Okay. All right. So we now know what brings it on.
Mm-hmm.
And now I kind of want to get an idea. What are you doing to ease those symptoms?
So a lot of times I'll just have to sit up straight, and kind of make sure that I have good posture. And then I guess when I massage that area, that tends to make it feel better too.
Okay. So massage and sitting up.
Mm-hmm.
Okay, so when you're massaging it, how long does it take for you to massage it? Does it take for it to go away? The pain?
Not long, probably about like 5 minutes.
5 minutes, okay. And then when you're sitting up straight, can you kind of give that a time frame of how long it takes for those symptoms to go away?
I guess about 2 minutes.
2 minutes, okay. Okay, so 2 minutes for when you sit up straight, and then 5 minutes for when you're trying to massage that area. Okay. So we have an idea of what brings it on, what eases the symptoms. Can you run me through a day, how your shoulder feels throughout? We'll start with the morning. How does your shoulder and your hand feel throughout the morning?
It kind of always hurts in the morning, to be honest.
Mm-hmm.
I don't wake up and it feels great. You know, kind of starts out bad.
Okay. How about throughout the day? How are those areas feeling?
Throughout the day, it does get better. You know, once I get my workout in and start, walking around, then it does get better.
Okay, so it gets better as you get moving.
Mm-hmm.
Okay. And then how about at night? How are those areas feeling?
Well, at night, I guess I have a hard time going to sleep because of it. And so that's why I'm tired. Sorry. Yeah, I have a hard time going to sleep, but I guess once I am asleep, I stay asleep.
Okay. So it doesn't wake you up in the middle of the night. It's just hard to get comfortable.
No, I'm a pretty heavy sleeper once I get there, but like last night, I fell asleep. I don't think I fell asleep till like 2 a.m. just because I couldn't find a comfortable position.
Mm-hmm. Okay. Okay. I'm going to take this time to kind of go over the form you filled out when you came in, before I brought you back. So it says that you are taking some whey protein. Is that for the CrossFit?
Oh, yeah, for the gains.
Yeah. My brother does CrossFit. He takes a lot of protein. I've noticed that.
Yeah.
And then it says here that you like to learn best by doing or seeing things. Is that correct?
Yeah, I like to mix mediums when I'm trying to learn things.
Okay, yeah, definitely. So at the end of the session, we may give you some exercises to take home with you. So I'll make sure that I help you perform them here, and then I'll give you like a paper with the exercise on it to remind you of how to do it, okay?
Mm-hmm.
All right, and then it doesn't look like you smoke or you drink alcohol? No? Okay. And then it looks like you have a family history of diabetes and blood pressure. Is that correct?
Yeah.
Okay. And have you gotten checked for that with your doctor, or are you in communication with your doctor?
Yeah, I'm fine. My parents have those complications because they don't really work out.
Okay.
And so they're a little overweight.
Okay. And then no history of cancer for you or your family?
No.
Or stroke? Okay. And then it says that you have some abnormal sensation or numbness. Did you circle yes?
Yeah, that's my finger.
The finger. Okay. And then the difficulty sleeping, is that what we were talking about a little bit earlier? Okay.
Yeah.
All right. Okay. So just to go back to, you were telling me a little bit about when you cough and sneeze, you have an increase in your symptoms. Do you have any pain in your tummy or anything like that? Where are you feeling that pain when you cough or sneeze?
Back here.
Back in that area.
Mm-hmm.
Okay. Okay. And have you gotten any sort of x-rays or MRIs done?
Actually, I did have one about 4 days ago. No, probably about a week ago.
A week ago? Okay, so x-rays about 1 week ago. And did whoever took them, your doctor, did they explain what they saw?
They just said that they were normal.
Okay, so normal x-rays. Okay. And then, are you taking any medication?
Yes, I'm taking ibuprofen and I'm taking Robaxin.
Okay, and what are you taking the Robaxin for?
It's a muscle relaxer that my doctor gave me.
Okay, thank you. And when are you taking the muscle relaxer?
I take it about twice a day.
Twice a day. Are you taking that before, after you're working out, during?
I normally just take it first thing in the morning because that's when I'm having the pain. And then as I go out the day, it gets better. So like after I'll take it in the morning, then I'll go work out, and I'll go about the rest of my day.
Okay. And did your doctor give you any information on when you should take them?
No, the bottle just said every 12 hours, so I try and take it at 7 in the morning before I go to work out, and then I take it when I get back home from work.
Okay. So maybe just clarify that with your doctor to make sure that when you're taking them, let them know that you're doing CrossFit, and maybe they can advise you when to best take them because you are pretty involved and that involves a lot of lifting. Okay. And then the ibuprofen that you're taking, how often are you taking that and how much?
I take that one 3 times a day, and I think that's 800 milligrams.
Okay. And what is that for? Is that for the pain that you've been having?
Yeah, the doctor gave that one to me as well.
Okay. All right. So I have a really good idea of where the pain is, what it feels like, what brings it on, what makes it ease. Can you tell me a little bit of history behind it? What caused it? Was there an accident or something?
So actually, it probably started about 2 weeks ago. We had a CrossFitting deadlifting competition, which I won, but it really started hurting after that, and so I got worried because I was lifting a lot of weight.
Mm-hmm.
And so I went to the doctor that day, and he gave me an injection. He said that everything would be fine, but then it wasn't getting better. It wasn't really changing.
Mm-hmm.
It wasn't getting worse or getting better. So a week ago, that's when I went back and I got the X-ray, and he said that everything was normal, sent me home. But he said that since it hadn't gone away, that he wanted me to come here. So then I went ahead and made the appointment here. And then 3 days ago, after I made the appointment, that's when my fingers started having the numbness and tingling.
Okay.
So
then you came.
Yeah.
Okay. So let me just clarify. So about 2 weeks ago, you were involved in a deadlift competition, which you won. Congratulations.
Thanks.
And then that's when the symptoms kind of started coming on. And then you had an appointment with your physician, and they gave you an injection, some medication for the pain. Do you know what kind of medication or what injection they gave you?
Oh, I think my doctor called it Toradol.
Toradol? Okay. All right. And then the symptoms weren't really changing. And then about 3 days ago, you got that numbness and tingling, and now you're here. Is that correct?
Yeah.
Okay. All right. And have you had any previous pain like this before? Any neck pain, shoulder pain? Again,
no, this has never happened to me before.
Okay. All right. Well, I've gotten a lot of good information here, but what I really like to focus our treatment about is some goals that you might have coming in today. Do you have anything that you'd like to accomplish coming to PT?
I just want to get back to working out.
Okay.
That's kind of what I love to do. That keeps me healthy, it keeps me active.
Okay. Well, we will definitely center our treatment around that. I really want to get you back to the gym and get you back to, no pain.
Mm-hmm.
So what we're going to do now is we're going to go ahead and move on into the actual physical exam. So if you can go ahead, or do you have any questions for me before we go to that?
No,
nothing like that. Okay. So what I'm going to start by is, actually, how are you feeling? The same scale that we talked about earlier, 0 to 10, where are your symptoms at right now?
So probably about a 4. We have been sitting for a little bit.
Okay, so 4 out of 10. Okay. All right, so what I'm going to start off by doing is kind of just moving you through some different motions. At any time during this exam, if you have any pain, communicate that with me. We really need an open communication, so don't be afraid to let me know if I'm just irritating you with certain motions, okay?
Okay.
All right, so if you can, let's start off by bringing our arms up all the way above our head. Mm-hmm. Good. Any pain with that?
No.
Nothing like that? Okay, and then all the way to the side. Good. Any pain with that?
No.
Good. Okay, and then go ahead and try to take your left arm, put it all the way across without the help of, there you go. Good. Any pain with that?
No.
Okay, and then the other side across. Good. Okay, and if you can stand up for me and try and run as far back as you can. Good. And relax. Any pain with that?
No.
Okay, So now what I'm going to do is apply a little bit of pressure. So we're going to go through the same movements. I'm just going to kind of push on it a little bit. So we'll start with this side. If you can go ahead and same motion, good, and a little bit of pressure, good. Any pain with that?
No.
Okay, let's try this side. Go ahead and all the way back for me. Good. Any pain with that? Okay, so you can go ahead and sit down. All right, and then we'll try this side, arm over your head. Good. Any pain with that?
No.
Nothing like that. Arm up. Good. Good. Any pain with that?
No.
Arm across your chest. Good. Pain with that?
No.
Okay. Same exact thing on this side. Arm over your head. Good. Pain with that?
No.
No. Arm up to the side. Any pain with that?
No.
Okay. And then across your body. Perfect. Any pain with that?
No.
Nothing like that? Okay. You can go ahead and stand up. I'm going to actually ask you to go ahead and reach down, touch your toes. Perfect. Okay, come back up. How's that feeling?
Feels fine.
Okay, and then hands right on your bottom area. And what you're going to do is you're going to lean back as far as you can. Good. Any pain with that?
No.
No? Okay. So now if you can take a step back for me, I'm going to ask you to do the same thing, but again, I'm going to apply some pressure. So if you can go ahead and touch your toes. Okay. Any pain with that?
No.
No? Okay, and then take a step forward for me. Then I'm going to go ahead and support you from behind, and then arms across your chest there. Good. Okay. Any pain with that?
No.
Okay. And then we're going to go ahead and just write this down real quick. Okay, and then if you can, go ahead and take off your shirt for me. I'm just going to observe your posture here. Good. Okay, you can just go ahead and stay like that. Okay, and then if you can face me. Good. All right, and then go ahead and face the wall. Okay. And then go ahead and turn towards that wall there. Good. Okay. And then what I'm going to have you do is go ahead and just walk towards that wall in front of you and walk back. Good. And then back. Good. Right about there. Okay. And then you can go ahead and take a seat now.
Can I put my shirt back on?
We're going to do a couple more things, so if you don't mind.
Okay.
Okay. I'm just going to observe you sitting here real quick, make some mental notes. Good. Okay. So, if you could show me, just off the top of your head, something that you have trouble with,
I
and
guess
brings on that pain.
when I was coming here and I had to take a right turn, I had a hard time checking my blind spot. So that's, I guess, something that hurts.
Okay, yeah. So, kind of rotating to the right brings on that.
Mm-hmm.
And on the same pain scale that we've talked about previously, how would you rate that?
Probably about a 4.
4 out of 10? Okay. So what we're going to go ahead and do is just run your kind of neck through certain motions. So if you can go ahead and reach back for me, your back of your head to like your back area. There you go, reach up. Perfect. And then back, how does that feel?
Fine.
Okay, and then chin to chest for me. And back, how does that feel? Okay?
Yeah, I just can't go down further than that.
Too far? Okay. And then if you can rotate towards me, yeah, as far as you can.
Oh, that's a little uncomfortable.
Okay. And then back. Did the pain go away?
Yeah.
Okay.
Just when I get at that end.
Okay. And then if your left ear to your left shoulder for me. Okay. Any pain with that?
No.
Okay, so go ahead and rotate to the right and let me see how that feels.
Probably about right there.
Does that bring on your symptoms?
Yeah.
And how about the side bending to right ear to right shoulder?
That's about as far as I can go.
Okay. And how are your symptoms with that?
Kind of worse. When I side bend, the tingling kind of gets a little worse.
Okay. So just like with the arms and the back, I'm going to apply some pressure. What I'm going to do is I'm going to avoid putting pressure towards the rotation to the right and the side bending just because you're already having pain with that. But I'm going to move you through the other motions and just let me know if your symptoms change at all.
Okay.
So if you could, go. I'm just going to.
That's okay.
Okay, a little bit of pressure. Go ahead and move that. Is that okay?
Yeah.
All right, and then side bend a little bit. Go. Fine. Okay, and then a little bit of rotation here.
A little uncomfortable, but as soon as you stop, it's gone.
Goes away. Okay. So those seemed about normal. Those the ones that we did. We're gonna go ahead and I'm gonna run you through just a quick test to see the sensation in your upper arms and neck area, and then also how your muscles, your strength of your muscles, and then your reflexes. Okay. So what I'm gonna ask you to do is close your eyes, and what you're gonna feel. I'm gonna go ahead and touch your leg here. Is just a slight tap, just like that, on different areas on your upper body, and I just need you to tell me if one side feels the same as the other. Okay. So, does this feel the same as this?
Yeah.
Okay. Does this feel the same as this?
Yes.
And does this feel the same as this?
Yes.
Does this feel the same as this?
Yes.
And if you can lay your hands on your thighs there, good. And does this feel the same as this?
No, that feels different.
Okay. On which side?
On the right side.
Right side. And so it just wasn't the same.
Yeah, it just wasn't the same.
And does this feel the same as this?
Yeah.
Okay. And how about this compared to this?
That feels the same.
Okay. And this and this?
Same.
Same. And this and this.
That's about the same.
It's okay? Alright. You can go ahead and open your eyes.
Okay.
And what I would like you to do is, if you can, go ahead and arms up for me. Just like that. Perfect. I'm going to put some pressure. I'm trying to resist that pressure.
Okay.
Hold, hold, hold. Good. Perfect. And then if you can go ahead and bring just this side, we'll start with this side. Bring this arm up. Perfect. Okay. And hold there for me. Hold, hold, hold. Good. And okay. Hold, hold, hold. Good. Hold, hold, hold. Perfect. Hold, hold, hold. Good. Do this side. And then remember, if this brings on any pain, just let me know. Go ahead and bring this arm up. Good. Hold, hold, hold. Okay. And hold, hold, hold. Good. Hold, hold, hold. And hold, hold, hold. Okay. Alrighty. So, alright, and we're going to take some reflexes here. We'll start on this side. You can go ahead and take this arm and put it on your side here. Good. Okay. And then go ahead and just lay it out here for me. Perfect. Okay. Go ahead and relax this arm here. Okay, and then same idea here. Go ahead and perfect, just like that. And then hand out there. Perfect. Okay. And then just go ahead and relax the elbow here. Okay. And let's try it on this side as well. Okay. And then if you would like, you can go ahead and take off or put back on your shirt. Right. Now what we're gonna do is I'm gonna go ahead and just take some measurements, okay? Alright, so what I would like you to do is go ahead and go as far back from me as you can. Good. Alright. Any change in symptoms there?
No.
Okay. Alright. And then if you can go ahead and go as far down as you can. Alright. And was that painful at all?
It's a little limited.
Okay.
Yeah.
But no change in your symptoms?
A little bit.
Okay. Okay. And if you can go ahead and rotate towards your left for me.
Yeah, this one's a little uncomfortable, like I told you earlier.
Go ahead and come out. And then to the other side.
That's about as far as it can go.
Okay, and come out of that. Okay. Alrighty. And then the next one we're going to do is we're going to do ear to shoulder. So if you do it with your left side for me. Okay. And then go ahead and go to the other side.
That's about as far as I can go.
Okay. And relax. Okay. So most of them seem normal. It's just the rotation and the flex, or the bringing your chin down. You have about around 4 fingers coming down and about 45 degrees going to the right. So a little restricted.
Okay.
All right. And now I'm just going to do a couple of different little tests. So we're going to go ahead and if you can, I know it's a little provoking, but if you could rotate or side bend this ear to this shoulder here for me and tell me how your symptoms feel.
I mean, if I do it just a very little bit, it's okay. You know, it's like when you told me to go as far as I can, that's where it was really like bothering me.
Okay. So does that bring on the symptoms in your hand?
A little bit.
Yeah, so you get that pain already once you try and push to the right as far as you can.
Yeah.
Okay, so usually I would put some pressure down, but because you're already having the symptoms, I'm gonna refrain from doing that, okay?
Okay.
Okay, and then you can go ahead and lay down here for me. One more test. All right, so with this test, I'm gonna move your arm through some different motion, and I just want you to tell me when you feel any symptoms, or if you feel any symptoms at any time, okay?
Okay.
If you can scoot a little bit towards me.
Okay.
It's okay?
Oh, right there.
Right there?
Mm-hmm.
Okay, so you get that the sensation?
Yeah.
Okay. Go ahead and relax. Is that kind of flared up a little bit in the way?
Yeah, it made that tickling a lot worse. Like it all of a sudden was like, woo,
Okay.
bazinga.
Okay, you can kind of center yourself a little bit more. Okay, so I'm just gonna apply some pressure to the neck. Just go ahead and relax for me, and again, keep me updated with your symptoms, okay?
Okay. That feels good.
That's good.
Yeah, the symptoms, like in that last test, they made it worse, but this one makes it better.
Okay, so did they kind of just go down a little bit?
Yeah, just a little bit. They're not gone completely, but they are better.
Okay. All right. Now I'm going to have you go ahead and turn onto your stomach here. Remove this one. Okay. So I'm going to apply some pressure on different parts of your lower neck. I'm going to go ahead and move this just a little bit so I can reach some areas. Okay. And then if at any time you feel some uncomfortableness or those symptoms that you haven't, just let me know, okay?
Okay.
Some pressure here.
Feels okay.
Okay. A little bit above.
Oh, that's real achy.
Achy. Okay.
Mm-hmm.
How's the? Did it go into your hand at all?
No, not that. No.
Not too much. Okay. So I'm gonna go off a little bit to the left on that one there.
Okay.
How's that feel?
Yeah, that's about the same achy.
Okay. And a little bit to the right here.
Ooh, that one's real worse.
Worse. Okay. And did the symptoms travel down at all?
A little bit, yeah.
Okay. All right. I'm just gonna go a little bit above. Tell me if the symptoms increase or decrease at all.
No.
Everything's okay there?
Yeah, everything's fine.
I'm gonna go a little lower. Everything's okay there?
Yeah.
Okay. I'm just gonna kind of touch your lower back here and let me know if it brings on any of the symptoms. No?
Ooh, it's kind of tender there.
Tender up here?
Mm-hmm.
Okay. On the top of the shoulder blade here?
Yeah.
Okay. Anything lower?
No, not really.
Okay. And then anything over here?
No.
Okay. And if you don't mind, I'm just gonna pull up your shirt a little bit just to see if it's warm at all. And then just to confirm this area right here.
Yeah.
Okay. All right. You can go ahead and sit up for me. Bring you down a little bit. Okay. So just based off of those different sorts of tests, I kind of have an idea of what's going on. So in your spine here, you have different vertebrae, okay?
Mm-hmm.
And in between those bones and vertebrae that make up your spine, you have little discs. And coming out from there is these nerves come out from each segment, each area of those, in between each of those vertebrae. And they come and go throughout your arms and different areas of your body to give it sensation and feeling. So what's going on, I believe, is when one of those is kind of compressed or constricted due to, it can be all sorts of things, it sort of starts to refer down that area of where it goes. So if you have a nerve up there that travels down here, you're going to feel it down here because it's restricted there. So just from looking at your posture, you have in the neck, it's a little straighter than it should be, so which can cause some compression on those nerves in your neck.
Mm-hmm.
So one of those may be constricted, and that's why you're feeling that numbness and tingling in there. And that can also cause the back of your neck to get really tight, and these guys in the front start to work a little bit less. So that's what I believe is going on, because when I was pulling on your neck, allowing for that kind of that area to kind of open up, the numbness and tingling went away in your arm. Is that correct?
Yeah.
Yeah. So by opening up that area, which is something we can focus on with PT, hopefully the numbness and your symptoms will decrease. And we've dealt with this case with a lot of different individuals, and it has a good outcome. So I'm hoping that we can have the same outcome for you. Is that something that you're interested in working on here in PT?
Yeah, I'm really looking, so is there something that I can do like that, like you play on my neck, that will help?
Yeah, so before you leave, I definitely want to help you with your symptoms, so we're going to go ahead and try. I'm going to distract that area a little bit. That's what the pulling is called, the distraction. and hopefully that'll help your symptoms. So, and then I can also send you home with some exercises or some home distraction as well. Does that sound interesting?
Can you explain that a little bit more? Like what kind of what home distraction is?
Yeah. So what's going to go on is you can grab a towel and you can kind of fold it up and attach it to a string. And then what you would do is just like this door here, you would attach one part of the string to that, and then with the side that has the towel on, you would kind of lay up against that and kind of move forward. I could definitely give you, I'm going to explain it as well if that's something you're interested in taking home.
No, I don't think that'll work very, very well.
Okay. Well, I do know that you like to do some exercises. You're very involved, very active. So I have a couple of exercises that will involve stretching those areas that I told you about here and working these guys here that aren't working to their full potential. And we can send you home with those if you're interested in those.
I don't know. We can try it because I like exercise, but I don't know.
Okay. Well, is there something, I've kind of given you a couple options. Is there something that you believe will help benefit your pain a little bit more?
Well, like when you're working on me, so I think if I can come here more often, that will help because you're kind of working on it, and like I told you earlier, kind of massage tends to help. So I think that would be a good idea.
Okay. Yeah. So how do you feel about those exercises?
Yeah, I guess I'll try them. I do a lot of exercises on the outside of work and things like that, and I do kind of believe in the power of exercise, so I guess I can give those a try.
Great, perfect. Okay, so we'll get to those in just a minute, but what I want to do is I'm going to lift you up a little bit, and I'm going to ask you to lay down, and I'm going to kind of work on that area, doing that distraction because that seemed to help. And what I want you to do is after I do the distraction and teach you the exercises, when you go home, I want you to keep track of how your symptoms are feeling and kind of know, so when you come back, you can tell me how long maybe this distraction helped or didn't help, and how beneficial you felt like the exercises were when you come back, so I have that information, okay? So if you can go ahead and lay down for me.
Okay.
So just like I was doing before, you're going to feel a little bit of pull. And so during this time, just explain to me how your symptoms are feeling and if the symptoms go away completely or if they're kind of decreasing.
No, it feels better. They feel like they're decreasing. Okay. Like before after you did that arm test, I kind of felt it go into my arm, and that had never happened before, but now it's like kind of in my palm, kind of around this area.
Okay. So decreasing and kind of coming more centrally. Okay. So like you said, as you go home, just let me know. You said it kind of came a little more further up your hand. Let me know if that goes away at all or if it gets better and you don't feel it when you go home. Just keep track of those symptoms, okay?
Yeah, it's feeling a lot better.
Perfect. Okay, so now we're going to go ahead. I'm going to explain the exercises to you that I want you to do. So
Okay.
if you can go ahead and your chin to your chest for me as much as you can. And what I want you to do is kind of try and push your chin to the table as much as you can. Okay. And then come back out of it.
Okay.
Okay. Try it one more time. Chin to chest and push back.
Do I hold?
Yeah, and then come out. Okay, so that's one. So you just go down and push back and then come out. Okay. We're going to do 10 of those.
Okay.
And then, well, first off, tell me how that feels. What do you feel is going on with this exercise?
I feel like a stretch back here, but then I also feel like my neck is working.
Good. Okay, so like I said, with the kind of straighter neck that you have, when I was looking at you when you were seated, it's kind of causing these guys to work extra hard and these guys to kind of slack off a little bit.
Okay.
So just like when you're exercising at CrossFit, if you're using your legs a lot, you might get a little bit of soreness. So that's what's going to happen to these guys. And then these guys are going to kind of stretch out a little bit, okay? Which should help with the curve to kind of come back, the natural neck curve that you should have there, which should hopefully open up the area for the nerve to be less constricted. Okay. So let's do about 8 more of those.
Okay.
Good.
3.
Good. Okay, how does that feel?
Feels good.
Good? Okay. Perfect. Okay, go ahead and sit up for me. Let me bring you down. Okay, so I'm going to go ahead and print out a piece of paper with those exercises on it. What I would like you to do, you did 1 set of 10 here. Depending on how you feel tomorrow, if you feel very sore from here or here, I'd like you to do 2 sets of 10. So do them 10 times, 2 times. But if you're feeling pretty good and not as sore, let's go ahead and shoot for 3 times 10. And do those every day until hopefully when we see you next time. Okay. Do you have any questions for me?
No. Yeah, you've been really informative. So thank you.
I'm glad I can help. Hopefully, this is something that you can see yourself doing, and we can help you get back to the gym without that pain. Let's go ahead and head up to the front desk, get those exercises for you, and get you scheduled.
How many times a week am I going to be coming?
Let's do, since the weekend's coming up, we'll wait until next week, and we'll do it at least 1 time next week. And if you can kind of schedule maybe for like Monday, Tuesday, and we'll see how we can progress from there, okay?
Okay.
All right.
We'll do.
Let's go ahead and go up there.